Hello, everyone, and welcome to our Week 1 live lecture. Today, we will be reviewing Medicare and all of the different parts of Medicare. My name is Cynthia Bennett, and I will be your facilitator for this session. So, Medicare is actually broken down into four different parts. You have your Medicare Part A, which is for your hospital insurance, your Medicare Part B, which is for medical, like office visits. You have Medicare Part C, which is the Medicare Advantage plans. And then you have Medicare Part D, which is the prescription plans. So Medicare is one of the largest health insurance programs in the United States. So in most hospitals and healthcare facilities, doctors' offices and things like that, they will accept Medicare. So this is why this plan becomes very important. It is administered by the federal government. CMS is responsible for the operations part of the Medicare program. And every few years, they select new Medicare administrative contractors, also known as MACs. These MACs will process the claims for the fee-for-service providers. So it will be for Medicare Part A and then also for Medicare Part B. So there are different insurance companies who will apply to be a MAC, such as like Blue Cross and Blue Shield. That's one of the plans that may opt to try and get the contract to process the actual claims. So Medicare eligibility. So this is very important because our patients will be coming in and sometimes they don't always understand their insurance or they may ask you different questions. So this is why Medicare eligibility becomes very important. So some of the general rules for eligibility is the individual or a spouse who have worked for 10 years in a Medicare covered employment, they may be eligible for Medicare. Individuals who are a minimum of 65, individuals who are citizens or permanent residents of the United States, or individuals who also, they may qualify as well. And some of those individuals may actually be under 65 because they may have a disability or they may have end-stage renal disease. So this will allow them to qualify for Medicare. So for Medicare Part A, this is normally going to be for your individuals that are 65 and older who receive Social Security or Railroad Retirement Board benefits. They're also are eligible to receive Social Security or the RRB benefits, but have not filed them yet. Also have had Medicare coverage through government employment. Also, I mentioned before the individuals who are under 65, mainly you're going to see people who have some type of disability or the end-stage renal disease. So as far as the enrollment process, enrollment is handled in one of two ways. Individuals are automatically enrolled or they may actually go in and apply. So individuals who are 65 and older do not pay a premium for the Medicare Part A if they or their spouse have worked and paying Medicare taxes while working. They will be entitled to the Medicare Part A and they won't have to pay a premium. So a lot of times this will be on their card. It'll let you know that they have Medicare Part A only because they can just have Part A only and not have actually Part B. And the reason why is because Medicare Part B, they actually have to pay a premium. So it is up to the patient to decide if they want to participate in a Medicare Part B premium. And this premium is usually going to be paid through their Social Security, or if not, if they're still working, they could possibly pay it through the online portal on the Medicare website. And you'll know rather the patient actually has Medicare Part B because it'll be indicated on their card. It'll say Medicare Part A and it'll have an effective date. And then it'll also have Medicare Part B and it'll have an effective date. So Medicare automatic enrollment, individuals not yet age 65 who already receive Social Security or RRB or disability benefits, they will automatically be enrolled. So if they already are receiving any of those benefits, they don't have to actually do anything because they're basically already in the system. So they will automatically just be moved over into the Medicare program. And that'll be effective the month of their 65th birthday. So here's a sample of how the card looks. So remember I mentioned earlier where it will indicate whether they have Medicare Part A or Part B and the actual date of effectiveness. So this is the where you'll find that information on the card. So always ask the patient for the card, and in that way you can be sure which parts of Medicare do they have and what is their effective date. So this is a great example of how the card would look. So the original Medicare program, also known as Medicare Fee-for-Service, and the reason why they call it fee-for-service is because the healthcare provider is paid a fee for every service that is provided. So if they have an office visit, and let's say they also have an EKG, they can bill for the office visit and for the EKG. So that's why they call it fee-for-service. It includes Medicare Part A and Part B. It's available nationwide to anyone who's eligible for Medicare. And then you also will have some patients who will subscribe to a Medigap plan. And so what this Medigap plan actually does is it will cover, for example, the patient's deductible or the patient's coinsurance. Because Medicare does not actually pay 100%. So some patients will actually have a Medigap plan as well. So under Medicare Part A, which is the insurance side of it, they will pay for things like inpatient hospital care for critical care. They'll pay for skilled nursing visits. They'll also pay for hospice, home care, and all of those types of services are going to be submitted on the UBO4 claim form. So you'll also hear people say facility-based billing will also appear under Medicare Part A, but most of those will fall underneath all of these categories. So just wanted to give you another name that you may also hear as well. So for the Medicare Part B, this is going to be for like your office visits to your doctor. So that's what they mean when they say physician services. So they also can be billed for if the patient is inpatient in a hospital and the physician visits the patient in the hospital. This is considered a physician service. So we can bill under Medicare Part B for that. Also, any outpatient hospital care, durable medical equipment, and then some services that are not covered underneath Part A, we can bill underneath Medicare Part B, and we're going to submit that claim on what we call the CMS 1500 claim form. So you'll also hear professional services. So any professional services can be billed underneath Medicare Part B, and we'll then submit those services to Medicare on a CMS 1500 claim form for all of our services that were provided. And it sounds like a lot of information, but once you actually start working in the field, a lot of this information will just become second nature. But I know it's a lot of information to kind of remember. So just think in terms of once you go out, you start working. Most of the time, you're either going to be billing Medicare Part A claims or Medicare Part B. So it'll definitely become more and more clear to you as you use it more and more. So Medicare Part C is for our Advantage plans. So this is when the patient has Medicare Part A and they also have Medicare Part B. So they've created a plan called Medicare Part C, and it works sort of like an HMO or a PPO. So those are our Medicare Advantage plans. So they will include fee-for-service plans as well. It just depends on which plan that patient chooses. Because once they go to Medicare Part C, which is our Advantage plans, they can choose, for example, one company will be like Humana, and Humana has a plan called Humana Gold. So the patient may opt to join Humana Gold. And one of the reasons why patients choose to do that is because they're going to get a little bit more benefits than they would with traditional Medicare Part A and B. So, for example, if a patient chooses an Advantage Care plan, it may cover, for example, eyeglasses. It may cover some of their prescription plans. It may cover other things that are outside of just the normal visits to our hospital. Some of them will give them a cash card where they can go shopping, where they can buy vitamins, where they can purchase other things. So this is an advantage to some patients. So that's why they will choose the Medicare Part C plans. So also, when you have a patient that comes in and let's say they just have Medicare, you want to make sure that you run that eligibility because they may just give you that red, white, and blue card and you're thinking they have Medicare Part A and Part B, which they do. But when you want to submit claims, we have to submit it to that Advantage Care plan. So once you run the eligibility for that patient, then it'll give you the information that that patient has an Advantage plan. And then you can say, you know, patient so and so, do you have, your Humana Gold card with you? And then that way you can also copy the front and back of that particular card so that you know exactly where to submit claims to, because you're going to be submitting those claims not to Medicare Part A or Part B. You're going to submit it to their Advantage Care plan. So it gets a little confusing, but once they have C, just think of it in terms of whatever plan that they're on. So for example, that Humana Gold, you're going to just submit all the claims there. And then that's the best way to think of it. And then once you're doing that, then, if it's, a hospital-based plan, then we'll use the UBO4 service. I'm sorry, if it's a hospital-based service, such as, they're inpatient in a hospital, you'll be using the UBO4. Now, if it's a physician office visit, you'll use the CMS 1500. So those rules still apply. Only thing that changes is that where you're going to be submitting those claims. So again, depending on where you're working, most likely it's going to be one or the other, either the CMS 1500 claim form or the UBO4. And then we have the last plan, which is Medicare Part D. Now, this is for their prescriptions. This is an optional program. They don't have to actually join Medicare Part D. So remember, I just mentioned the Advantage Care plans. Some of them actually will cover some prescription drug plan for patients, so they may not opt to do the Medicare Part D. It is an option for the patient. So they most certainly can join this as well if they want to. So they'll have to actually pay a premium in order to actually have access to these benefits. This one is not something that they will automatically get. So they'll have to make that monthly premium so that they can take advantage of this plan. So Medicare beneficiaries can present their Medicare prescription drug discount card to pharmacies, and they're able to now be able to use their prescription drug plan. So most patients who have the Medicare Part D, they normally will just have the Medicare Part A, Part B, and then D. Because most of the time they won't get the D if they have Part C, because some prescriptions are already covered. But again, it just depends on the patient. But 9 times out of 10, most of them are going to pick one or the other. All right, so now's the time for questions. So we don't have anyone here in our chat right now. But if you want more information as you're reviewing this recording, you can always log on to www.medicare.gov and they will be able to give you more information about Medicare and the different plans that they offer. So I hope that this lecture was helpful and that gave you a more clear understanding of Medicare and the different parts that they actually offer, who's eligible, who qualifies, how they qualify. So I hope that this information was helpful to you. So again, if you got more questions, please feel free to visit www.medicare.gov. Thank you.